as you get into your 40s and 50s, if you're having a hard time getting stronger, gaining lean mass, or you've lost a significant amount of mass and your body composition has changed for the worse, a lot of that is lifestyle habits. But at some point, if it's very challenging for you to regain your strength and size, or a reasonable amount of strength and size, hormone testing becomes pretty important, because in the absence of sufficient testosterone and IGF-1, some people may have a declining growth hormone, which at some point you see a decline in IGF-1. Those are pretty key components. Women, thyroid, can be affected, and those can all have adverse effects on, energy levels to train. Just your enthusiasm for working out is the huge component. Me, I've always said compliance is a science, and if you're just not enjoying getting to the gym, or don't have the energy, or if the workouts seem lackluster, get a blood test. Now they're so unbelievably affordable. I don't mean to pitch anybody here, but I've been working promoting Merrick Health for years. But over 10 years ago, I was talking about getting online blood tests and referring people to companies that you could just download a form and take it to like a LabCorp or a Quest, and within 3 or 4 days you had results that were pretty comprehensive. But 10 years ago, I was paying $300-400 for the tests that are now $150 through Merrick, a real comprehensive profile that they allowed me to set up that I've got on my website. And again, it's just, I've been talking about it for a long time. I'm not trying to sell anything here, but it's really important particularly as you get into your 40s and 50s, to at least get a baseline. And I've also said, in my Iceland seminar almost 9 years ago, it's got almost 7 million views now. I talked in detail through all of the vertical diet back in that seminar for nearly 2 hours. I said that if you get a blood test back and it looks horrible, implement some lifestyle changes first. Optimize your sleep. Maybe you've got apnea. Exercise regularly, stress management, change your diet, start going to the gym a little bit, and see if within 60 days you haven't made some improvement. And in the absence of improvements, and you feel as though you've invested enough effort and consistency into all those other lifestyle habits, then maybe you need intervention, medical intervention, because it's quite common that people men in their 40s and 50s, or women perimenopausal or postmenopausal, are going to suffer from hormone deficiencies that are going to significantly impact their ability to perform, even if it's just in terms of their energy and their ability to recover. That's a huge component. And then beyond that, of course, you're talking about estrogen and testosterone and IGF-1.
Yeah, I don't think a lot of them don't really understand the impact that your hormones have on just how you feel and operate throughout everyday life. Sitting here having a conversation, sitting at your desk, your work, you're running around with your kids. If your hormones are not optimized, you're going to be a lesser version of yourself in every single area of your life. Just in your, I guess, kind of generalized opinion, like, is there any reason as to why, once you've optimized the lifestyle stuff, if your numbers are still low, that you would say a guy shouldn't get on hormone replacement therapy?
It's kicking the can down the road. One of the things I worry about with low T, particularly if it's libido or erectile dysfunction, is what we call the canary in the coal mine. Is that a lot of times those problems, those pathologies, are the result of insulin resistance. And so now you've got this upswelling of potential, pre-diabetes. And taking testosterone doesn't solve that problem unless you lose weight and increase muscle mass significantly enough to utilize some of that glucose in your system. So what ends up happening is that you feel a little better in the short run. And this is why, in my experience, and I've been, in the HRT, close with people who are running HRT companies, and now, of course, as a mouthpiece for one for 20 years. And one of the biggest problems is attrition, that most of these men generally turn over at a rate of about every 3 or 4 months. And we see it pretty consistently that the first 30 to 60 days, they get significant improvements that they're looking for. They feel better. They start working out. They might optimize their sleep a little. They go to the gym regularly, and they start seeing all these benefits. And then after about 30 days, They stop working out as consistently. They go back to eating pretty crappy, which is common with everyone, to be honest with you. That's part of the problem with long-term dietary adherence, is that everybody just tends to not adhere. And they exercise infrequently, and then some of those benefits start to wane, and then they're like, oh, this testosterone isn't working. And it's not a panacea. It doesn't work by itself. It can help, as we mentioned, as we've been talking about, it can help motivate you to do more, which is, you can't underestimate the importance of that, just the motivation. But it's not going to do it for you. And then what I worry about is that, if people get on testosterone and don't change their behaviors, is that the insulin resistance gets worse until such time that they have diabetes, full-blown diabetes. So that's what I'm cautious of. There's no easy fix, but when you have sufficient hormones, and I hate to use the word optimize, because then people think that they can go in there and, tweak knobs and buttons, and suddenly things are going to change. But within the normal range, I'm talking about hypogonadal and people who are low T and hypothyroidism. People have low thyroidism, low thyroid, well below that of quote unquote the normal range. They're going to experience significant difficulty and adverse effects from that. But I'm just cautious, because then people go in and they want to try and manipulate everything, and it's very hard to do. Even endocrinologists struggle with something as routine as thyroid function in women, trying to quote unquote optimize, because different people respond differently to the dose, to the type, combination therapy. Some people do T4, T3. Some people just do T4. Some people just do T3. And then there's dosage to consider. And then, that's just a matter of consistently giving feedback and getting testing to try and, improve your health. I guess that sounds like optimizing, but there's no such thing. It's as much art as science. And you can't just see it. We always say, treat the patient, not the numbers. And somebody might walk in there with a testosterone of 300 and feel fine. And somebody might walk in there with a testosterone of 500 or 600 and feel absolutely terrible. And so you kind of got to take everything into consideration. It really does require a professional with testing plus follow-up, and trying to isolate variables rather than shotgunning. A lot of times they'll start getting into this whole supplement protocol, and they'll start taking all sorts of different vitamins and herbal therapies. And I mean, how do you determine, in multiple polypharmacy, how do you determine what effect you're getting and what's causing adverse effects if you're experiencing those? And so you gotta be careful and be patient, implement kind of one thing at a time, and get feedback and do your part. It's a long, tedious process. It'd be no different than if somebody came in with IBS and they undergo a low FODMAP diet and then have to reintroduce foods. That can be a long, tedious process of tracking and looking at trying to recover from something like that. And patience is the hard part. And then people who tend to deviate from the plan is generally what happens, is they just start going back to their old habits.
Differences between, injectable, topical, what are some of the other modes and modalities out there, and which one is going to be your kind of preferred way of taking testosterone?
So in general, 3 options. There's injectable, there's topical, and there's pellets. The fourth one would be oral, which I typically don't recommend. There's a new FDA-approved one that just came out recently that's oral. But in general, we've always worried about the liver in the past. And the new one, I just can't get levels up where you need them with the oral. But in general, it's injectable, pellets, or topical or pellets. And I always steer guys initially, at least, toward the injectable. So the injectable, in the past, it was always intramuscular injection, so big needle into your butt or into your thigh, quad muscle. We now recognize that you can do a subcutaneous injection and get similar benefits and results. And so I personally recommend that for all my guys. I do it myself as well, sub-Q, tiny insulin needle in the belly, just next to the belly button. And we typically recommend
taken more frequently because you're taking a lower amount.
Yeah. So that's actually absolutely the key, that the more frequent, the better. So back in my old days before I knew anything, when I was a budding urologist 25 years ago, we would give 200 milligrams, 1 ml every 2 weeks. And now we realize how how bad that was, because you're causing these big spikes and then it plummets, and then you have all these valleys all this time where your levels are low. And so the more frequent lower dosing is better. And so ideally it'd be every day, but from a compliance standpoint, from a lifestyle standpoint, no guy can realistically be expected to do it every day. 3 days a week would be awesome. Most guys, it's about twice a week, 3 times a week is kind of the sweet spot that you can get guys to do it. And the dosing really varies on your metabolism, how much muscle mass you have, and so we test. We'll give what we think is a good dose for you, and then we'll test, and we're constantly fine tuning because those numbers can change so much. Yeah. But to answer your question, injectable first, topical. All the alcohol-based gels that you can put on your chest and shoulder, I never recommend them. I used to use them in my old days before I knew anything. I can't get your levels high enough with those. As hard as I ever tried, they just don't work, honestly. What I will, if someone desperately wants topical, I'll use a Versa-based cream that you can actually apply on the scrotum. And the scrotum is used because it has amazing absorption. It's incredible absorption. And I can get your levels as high as I need them with a small little daily topical dose of cream. The downside, you got to use it every single day because it wears off. The half-life is so short that it'll wear off very quickly.
And do you notice, miss a day? Like, are you noticing the effects of something like that?
Well, yeah, your levels will be in the tank. So if you put it on this morning, by tomorrow morning, it's completely out of your system. It's pretty much gone. Yeah, and so some guys will have low T and don't necessarily feel it on a day-to-day basis. Other guys have dramatic symptoms, but nonetheless, if you skip a day, your levels are in the tank.
Your tank, yeah. And then where does peptides come into the protocol, and how are they affecting testosterone? How are they affecting the DHEA? How are they affecting some of these other hormones that we talked about? And I know there's a lot of different ones out there, so let's kind of explore that here a little bit.
So peptides are awesome. Peptides are simply short proteins. So for the listener to understand, a peptide is simply a short protein. A protein is simply a sequence of 100 amino acids in length or longer. If it's 50 to 100 amino acids in length, it's a polypeptide. Anything shorter than 50 amino acids in sequence is specifically called a peptide. So that's all it is a short peptide. Insulin is a peptide. Growth hormone is a peptide. And all peptides are actually endogenous signaling molecules, meaning these are signaling molecules that your body already makes that have very precise functions that have been identified as incredibly powerful that they can now replicate and synthesize. So, for example, there are peptides that are great for boosting growth hormone. So we know as we age, growth hormone levels decline, and that can affect sleep quality. It affects our ability to build muscle and burn fat. It can affect really the aging process. And so there are peptides that specifically will not be synthetic growth hormone that has some negative consequences, but instead can tell your pituitary, hey, make more growth hormone. So peptides for immune function. So when I had COVID back March 2020, when shit hit the fan, I had 4 peptides that were great for immune function that helped me recover from COVID. They're peptides for inflammation, whether it's inflammation in a joint. So for example, I had tennis elbow, and I used 2 different peptides, one that reduced inflammation in the joint and another one that helped with musculoskeletal repair and recovery. They're peptides for gut health, gut inflammation, peptides for weight loss. And there are a lot of different peptides for weight loss depending on what's the cause. So for some people with weight loss, it may be cravings, it may be can't stop eating. So it helps with hunger and satiety. Other peptides help with metabolism. Others help, like semaglutide is the biggest crave right now, and semaglutide is a peptide that mimics GLP-1. Basically, GLP-1 is made by your gut, and when you have issues with blood sugar, insulin sensitivity, your gut doesn't make GLP-1, and so semaglutide is a way that can help suppress hunger and improve blood sugar regulation. Peptides for improving sex drive, arousal, libido. Peptides for erectile function, for boosting performance. Building muscle, anxiety, sleep, almost anything you can imagine, there are peptides for. And the beauty of them is they are simply amino acids. They're simply short proteins, and they're signals that your body already recognizes. So, for example, the thymus gland is in the neck when in the throat when we are young, and it atrophies, it shrinks away at a very young age, and is gone the rest of your life. There are amazing immune cells from the thymus gland that are actually involved in longevity. And epitalin is a peptide, 2 amino acids in length, simply 2 amino acids put together. And it's been shown in animal studies to extend lifespan and reduce the incidence of cancers. Pretty cool stuff. So that's the power of peptide. It's icing on the cake of everything else that we've talked about.
Yeah, that was going to be my question. If there's a guy out there that still, after hearing our conversation today, is still on the fence about maybe the TRT, the hormone replacement therapy, would peptides be an alternative before? But what I think I heard you say is optimize it there, and then boom, this is going to kind of take it to the next level.
It's going to take it to the next level. If you have suboptimal testosterone levels, peptides are not going to be the best approach there.
It's not going to get you from the 6 to the 20.
No. Now, kisspeptins is one peptide out there that has been shown to help with boosting testosterone levels. I've never seen it have that much of an effect, and that's not necessarily the best way long term that you want to be supporting testosterone. So, for guys out there who maybe don't want to take testosterone for whatever reason, bias that it may be, as wrong as they may be, kidding. There are other ways that we can stimulate your body to produce testosterone other than simply give you testosterone. But one way or the other, you got to get your levels up. Yeah, and peptides can't fix that.
Yeah, you gave a great example, and I know there's going to be a big majority of the audience going to resonate with that 44, crushing it, executive, entrepreneur, maybe running a firm, something like that, just tired, exhausted. So he doesn't even have the time in his schedule to optimize some of these things. But there's going to be a segment of our audience that now is maybe in their mid to late 20s, maybe possibly even early 20s, but they've recognized, hey, some of these generational things. I can remember, going through puberty, boom, I instantly kind of had, the man boobs there, and it's something they've struggled with their entire life. When is it too early for a man to look at getting on some testosterone replacement therapy?
Yeah, any guy who is considering having children. So I've seen guys in their 30s and they're single, and they're like, yeah, I may want to have kids eventually. I'd be really careful there. If a guy's married and they just had a kid, for example, and he wants testosterone, I would be really sure they don't want another one before you give testosterone. It does suppress production of sperm. And so that's the situation where I might hold off on T and give other things. We can use HCG, we can use Clomid and clomiphene, other ways of stimulating testosterone. Yeah.
Jay, for the busy guys out there that are in their 30s and 40s and are looking to maximize muscle growth and maybe optimize cognitive function, in terms of getting started with peptides, where should they look at starting, and why is it important to maybe now begin to start integrating some of these things?
What's up, Frank? Thank you for having me on your show here today. Great question. As I always tell guys, before we get into peptides, to really make them work, we want to first understand if whether or not we have a hormonal deficiency. And so the first step is always to get your blood work done, right? Like in the United States, Canada, the West, first world countries now, there's 1 million independent laboratory companies out there that you can literally just go online like you're going to Amazon and get a free, total, and hopefully a sensitive estradiol test just to see where your estrogen and testosterone numbers are. Because unfortunately, a lot of men today start off with the peptides having a hormonal deficiency or dysregulation, and then they don't get the effects that somebody who would be, more balanced and more optimized hormonally gets. And then they say, oh, the peptides didn't work, or, they didn't work for me or whatever. Because whenever I hear that, I kind of laugh because peptides work for everyone. There's no excuse or, situation where they don't. It's just that sometimes when people are like really bad off hormonally, which, as you know, is like literally 75 to 80% of society today, because we're being annihilated from every angle, from the food, the air, the water, everything that we do today in the West is contaminated in some form or fashion. So I always say it's most important, first off, to find out whether or not you're working with a hormonal deficiency. And then, of course, if you are, to seek help with a physician who understands how to optimize your hormones. And thankfully now in California, in the United States, there's enough men and women who can help optimize a man's testosterone, estradiol, progesterone, all the basic endocrinological hormones to get to a place where they can now start looking at peptides, to build muscle, to enhance longevity, to burn fat, to improve cognition, all the things that you know about peptides.
No, that's great. And I'm glad that you went there first. And we're going to get into, some of the different peptides, different stacks, how these guys can really optimize both training and lifestyle. But I think for some people, they see peptides, maybe correct me if I'm wrong here, almost as a replacement to testosterone replacement therapy. And I think what you're saying is, no, your hormones have to be optimized in order for these things to actually work.
That's exactly right. Yeah. In fact, I kind of look at it like when I talked about this to people, and obviously, as you know, I talk to a lot of different people around the world about this stuff now, including people like your audience, and then also doctors and stuff too. But we have to look at the human body as a symphony orchestra, right? We have our endocrine system at the top. We have our thyroid gland on the right. And then we have our pancreas, which is our insulin production on the left. And so if you optimize with peptides before optimizing for those three things, you basically are going to be working on a one-legged stool. So it's very, very difficult to actually start peptides without first understanding whether or not your testosterone, your thyroid, and your pancreas are optimized. So you optimize your testosterone clearly through therapeutic testosterone. There are some medications you can take that improve FSH and LH, which is follicle stimulating hormone and luteinizing hormone. But most importantly for most men, again, 30, 40s, and 50s and up, it's therapeutic testosterone is the biggest tool in the tool belt. With thyroid, we're looking at using porcine or desiccated thyroid, because what happens is when you optimize for testosterone and estradiol and progesterone, you have to also optimize the thyroid, but you don't want to dysregulate natural thyroid production. So we use desiccated thyroid because it's a very mild form of thyroid. It's T1, T2, T3, and T4. And then the last leg, which might be the most important leg, is the pancreas, which is what produces your insulin. 90% of men in society today have insulin resistance. And the reason that is because they eat too much shitty food. They drink too much alcohol. They drink a lot of sugar-laden beverages, Cokes, fruit juices, all these different things. And over time, that causes what is known as insulin resistance. And just a real quick explanation of insulin resistance, your pancreas have what are called chemoreceptors in the walls of your pancreas. And as you get older and over time, as you eat refined carbohydrates and just call it junk food, the chemoreceptors start to give out. So you want to think of your chemoreceptors as the screen and porch door on a regular front door. And over time, the springs in your screen and porch door, if you're not, replaced or optimized, will give out. And so that's what your chemoreceptors are. So eventually, if you're eating like shit for a long period of time, which unfortunately in America, that's most people, the chemoreceptors fail and you can't control your insulin production when you eat carbohydrates. So the best way to optimize your pancreas for insulin sensitivity and to improve blood glucose is to take a bunch of different things, but my primary mechanism or weapon of choice is metformin, because metformin is very cheap. You can buy it on online pharmacies. My company, BioLongevity Labs, now sells it direct now because it's off patent, so you can pretty much buy it, anywhere. But metformin is a very profound longevity agent, and because it suppresses blood glucose sugar, and most importantly, it upregulates what is called Akkermansia mucilus, which is the probably the strongest, most impervious microbiome or gut pathogen. So that if you got shit growing in your stomach from eating like crap and drinking too much alcohol and not taking care of yourself, it'll kill a lot of that stuff. So those three things, if you do those three things, you're going to be in a very good space or place when you start peptides, because now your system is firing on all cylinders. So when you add peptides for whatever reason, and we can get deeper into the weeds on peptides, you're going to get much better effects. But that's unfortunately, Frank, 30 to 40% of the peptide universe is actually doing those things because they look at peptides as the new shiny object. And believe me, it is a shiny object. The majority of people in the world are looking at peptides right now because they're attempting to recover from vaccine injury. And even though most people don't talk about that, I have no filter. I'm glad to talk about that. I've benefited in my personal brand in my life because when I launched my book on peptides 2 years ago, it was literally like in the peak of people starting to suffer from that, debacle of the scamdemic. And so it just went to the top of the food chain on Amazon and, all these people, and people started asking me about talking about peptides. And so me and my business partner have actually created a vaccine recovery stack using peptides, but I don't really publicize it because I don't want my website to be deleted. You know what I'm saying? But I have that. So if any of your guys are suffering and they listen to this podcast, they can, of course, email me and I'll be happy to send it to them. I always send everything out for free. I don't charge people for this kind of information because it's too important. But to get into the weeds about peptides, we absolutely can. But doing those things, most importantly, is going to make sure it's going to standardize that your peptide adventure is really, really prosperous and successful.
Yeah. We'll see if we can link that back in there and maybe circle back to that vaccine conversation. I want to stay here on the muscle building side of things and maybe the cognitive performance for now. You brought up metformin here, and I threw this out to kind of my audience. I talked to some of my buddies that know you, follow your work. I got some friends that are in your 30-day to shreds program right now. I know you talk very heavily about metformin, and I think that there's been some recent articles and even some big name influencers, not to call anybody specific here, but Ben Greenfield coming out talking about maybe some of the harmful effects of metformin on muscle building. What are your thoughts? What is your understanding around the role that this can play? And are there any negative effects for maximum hypertrophy if we're taking metformin?
Yeah. So, I mean, like well, first off, it's kind of a misnomer. There's no negative effects for metformin. Metformin can, because it's so effective at regulating blood glucose and blood sugar, it can rate limit what is called mTOR signaling. And mTOR signaling is, responsible for IGF-1 production. It's also responsible for maximum force production. And so at the end of the day, like if you are not hormonally optimized, which again, in today's day and age, if you're not hormonally optimized, good luck trying to build muscle. Then it may limit your ability to generate maximum force and contractions. But again, calling a spade, and I've been obviously using metformin for 22 years. And I know thousands of competitive bodybuilders and pro strongmen that use metformin. It's not that big of an effect. Like Stan Efferding, who's obviously a good friend of me. I'm sure you probably know him, the Rhino. He's a very, very famous strongman. And him and I have debated this and, been on shows and podcasts and stuff like that. And even Stan, who's probably the smartest strongman on the planet, will say, me and Jay used to go back and forth, and Jay's right, but I'm also right, because if you're a strongman or you're competing in a lifting competition, you want maximum force generation. You need to come off your metformin for 10 days before your event, right? So that's kind of like the happy medium. But to what Ben is saying, and of course, Ben is also a good friend of mine. If you're not on testosterone, which again, you'd have to be crazy if you're 35 in the United States and not on testosterone at this point, because you probably have a deficiency, then yes, it might help, not harm. It might prevent you from maximum torque generation, but it does so many other good things, right? Like, and again, the number one thing metformin does is increases Akkermansia in the microbiome. My argument is that you want to be on it anyway, because you want to be impervious to whatever other, super bug or COVID or whatever else they got up their sleeve that's coming. You know what I mean? You want your stomach to be impervious. In fact, there's literally, bro, over 100 studies on PubMed and Medline right now from just during the scamdemic days of people who were on metformin who never got COVID. So that's how strong it is as an impervious, a blocker or an agent to keep your stomach microbiome super optimized. And so that's why I would say to take it. But as far as is it really going to prevent you from building maximum muscle? Unlikely, over time. And again, for the benefits of it are so good that it just outweighs that, that minimal risk of not being able to generate maximum force production in a lift. I've been using it for 22 years and I'm pretty strong and have a good physique. And I know a lot of bodybuilders that, take it, and obviously they're geared to the gills, but they don't notice anything bad. The one thing that I will say is that if you are, a bodybuilder and you're using therapeutic testosterone or more, and also growth hormone or growth hormone agonist peptides, you want to take metformin to prevent insulin resistance, because those drugs can actually cause insulin resistance when you take a moderate dosage for a long time.
That's another excellent transition to the fourth leg of the stool. We talked about sleeping, we talked about eating, and we talked about training. The next component to that is going to be your medical status. It's going to be your blood testing and whatever necessary hormonal interventions you may need to optimize your fitness, or medication if you've got high blood pressure or low thyroid, hypogonadism, testosterone, whether or not you're going to need to do some sort of medical intervention for abnormally high familial hypercholesterolemia. You get a blood test for that. Look at your lipids if your LDLs are out of whack. You said something interesting there. Do we intervene first with the medical, or does some of the lifestyle help with those problems? I believe you start with lifestyle. I believe you get a blood test first. Let's get a baseline. Let's figure out where you're at. And so that we know whatever we're doing, we can measure whether or not it's having the necessary effect. So blood test is first. And then I said this in my Iceland seminar some 7 years ago. It's got almost 7 million views now, where I went up to Iceland and Hafþór Bjornsson did a presentation up there. It's 2 hours long. I go over every detail of the vertical diet. And as I mentioned, there's some things in there I would probably deliver differently, but it was a specific audience of bodybuilders, powerlifters, and strongmen. But I said, look, hormones have a huge impact on your ability to lose weight, say your, hypothyroidism, on your ability to gain muscle, whether it's hypogonadism, and then just general health. So get the blood test, and then start to implement a lifestyle plan. Reduce the saturated fat, reduce your calories, get some weight loss, exercise regularly. Start with the walks and a couple of visits to the gym a week. Try and optimize your sleep, and now we're talking sleep apnea. If that's another medical consideration, if you're holding your breath and snoring at night and waking up tired, you might have some degree of apnea, and that's an intervention that is most likely benefited from weight loss. So you might try lifestyle first there as well. But if you can't remedy apnea, that'll have a huge impact on your blood pressure, on your blood sugars, on your energy levels, and you may need to get a CPAP to resolve your sleep apnea. Go hard for 30 to 60 days, and be consistent, trying to optimize your sleep and your nutrition and lose some body fat. I said on the Tom Bilyeu podcast that 95% of health benefits are realized strictly from weight loss itself, irrespective of diet. And I was skewered on social media for it, but it is a fact, and it's researched very well. And I said I would never recommend the McDonald's diet, but even with the McDonald's diet, we see improvements in biomarkers like blood pressure and blood sugar and lipids from weight loss. And I would not recommend a McDonald's diet for a number of reasons. Hard to comply with in terms of satiety, micronutrient deficiencies, potentially high in saturated fat, ultra-processed foods, etc. But if you can lose weight on any diet, you can realize health outcome improvements. Try and lose the weight, try and sleep a little better, try and exercise consistently, and then get another blood test 60 days later. And look at the markers that were out of range that you were concerned about. How much improvement did you realize from that intervention? And now if 60 days later or 90 days later, whatever time period it takes you to have a substantial change in your body weight, if you're 20, 30 pounds overweight, what we see in the literature is a 7% weight loss. It seems to be a pretty good initial driver of these health benefits. This is some of the research from the diabetes in particular. You can resolve about 50% of your NAFLD, non-alcoholic fatty liver, and dramatically reduce your blood sugars. Of 15% weight loss. Now, this is what I tried to accomplish with some of my athletes. If they're 300 pounds and you lose 45 pounds, a 15% weight loss can reverse type 2 diabetes for those people who already don't have pancreatic failure. You can restore pancreatic beta cell function with about a 15% weight loss on average, irrespective of how you lose it, I hate to say. But that can be pretty dramatic. So plug that number in if you're particularly compromised in terms of your metabolic health from your excess body fat. If you have elevated HA1C, fasted blood glucose, fasted insulin, high triglycerides, that's a great number to shoot for. If you're a 300-pound person, lose 45 pounds. How long does that take? At 1 to 2% body fat loss per week. You're looking. You can do that in 60 days, thereabouts, 60, 90 days. So go hard on that. Make that your goal. Lose that 15% if you can get there. 7 would be great. Get a second blood test. Call it 90 days. See what's improved or hasn't improved. And if you still have hypothyroidism, you might need to see a doctor and find out if you've got Hashimoto's or if you have some autoimmune disease. If you still have low tests, you got to go in and have a doctor find out what type of testosterone deficiency you have and why. Remedying those problems does have a significant impact on your health markers. Thyroid has a huge impact on lipids. If your LDL is significantly elevated and your thyroid's, you've got high TSH, meaning low thyroid, fixing that could fix the LDL. If you've got low testosterone, fixing that, maybe you have to get on testosterone therapy, could have a significant effect on your lean body mass and your ability to have the energy to want to go to the gym. And so those things become rewarding and more likely for you to comply with long term. So those are just some primary, some preliminary examples. LDL would be the other major one, other than blood sugars and blood pressure and testosterone and thyroid. Some people are hyperabsorbers of cholesterol and may not be able to eat eggs. About 20% of the population will convert esterified cholesterol into blood cholesterol and raise LDL. And some people, from whether it's from familial hypercholesterolemia or from insufficient clearance of cholesterol or too much saturated fat consumption, reducing the LDL receptors in the liver, may recirculate cholesterol to such a degree that they've got elevated LDL or ApoB, and might have to eat even less saturated fat or avoid eggs or increase fiber or a combination of all of those. And if lifestyle doesn't work, then you may be a candidate depending on your other risk factors, and maybe a CAC scan or a coronary angiography to look for soft plaque in the arteries. You may be a candidate for some medical intervention, which doesn't necessarily have to be statins, because we have ezetimibe is a cholesterol lowering medication that's not a statin. PCSK9 inhibitors are extraordinarily effective. They're not a statin. So if you have an aversion to try statins, but nowadays the statins have evolved to where they have a lot fewer side effects, and they can use low-dose combo therapy as recommended by Dr. Tom Dayspring. An ezetimibe rosuvastatin combination in very low dose, incredibly effective. Lane Norton has used, maybe is still using statins because he couldn't get his LDL down under 130, and he eats 60 grams of fiber a day. He's huge on fiber, and eats a low saturated fat diet, but genetically he's just unable to get his LDL down. Dr. Soko, who's a PhD exercise phys, Dr_SOKO on Instagram, uses a PCSK9 inhibitor and has his LDL cholesterol down in the 50s or 60s, similar to what you were when you were 8 to 12 years old. And we see evidence that with the Mendelian randomization, that people whose cholesterol is in the 50s and 60s and below, their ApoB in particular, never acquire atherosclerotic plaques, and will go their whole life without that being a potential factor for cardiovascular disease. So that may be a longer conversation, but I'm just saying that you hit on an important point. Get a blood test, use your lifestyle interventions, maximize those, get a subsequent test, see a doctor if you need medical intervention to address any of the other issues.